Okay guys, I am super excited about this month's video series because it's all about the neck. So a couple months ago I did a series on the back, what to do when your back goes out. So this month it's going to be what to do when your neck goes out or when you wake up with a crick in your neck. The first video is going to be on what exactly happens there. Is it a muscle thing? Is it a bone thing? We'll talk about that. The second thing I'm going to talk about is what to do pretty close to right away after you find that you have some neck pain. I find a lot of you do the exact opposite thing you should be doing with acute neck pain. So we're going to talk about that. And then the third thing we're going to talk about is my number one favorite exercise that I like to use to strengthen the neck to avoid some of these neck problems. So join me in just a few days. It might be tomorrow, it might be the next day, and we'll start this video series. And I think you guys will like it and learn a lot about your neck. So I'll talk to you soon. Bye. Okay, so a crick in the neck is usually a muscular thing, and it typically happens in one or two ways. One is kind of a neck strain that you get from maybe lifting something too heavy or doing an exercise where you really kind of strain into your neck. And the second way is when you have your head in a position, and it can be either way, where the pain in the neck can come from this part of the side of the neck where the muscles have been compressed and are too short, or it can be from this side where the muscles are stretched and too long. It's usually this side I find in most of my patients. So you will also feel a lot of times with neck pain, you also feel it kind of going down into the shoulder blade. So you can kind of see here, this muscle here, the levator scap, kind of comes off this vertebrae and comes down out to the shoulder blade. So you often kind of feel pain down in there. So tomorrow we'll talk about what to do when you have this kind of muscular pain and what's the best way to start getting rid of some of that pain. See you tomorrow. Okay, so you have an acute episode of neck pain. What should you do? First off, go ahead and do all those things that you normally would do for any other type of muscular injury. Do some ice if you like it, do some heat if you like it, take some ibuprofen or some Advil, all those things are good. The one thing that most people do that I think is opposite of what they should actually do is they actually try to stretch and move their head and neck in the opposite direction of the pain. Meaning, like, if my neck hurt on this side, they're kind of stretching to this side, they're turning away from it, trying to make this side longer, when these muscles here are already hurting because they're stretched out. That's typically the cause. So instead of stretching and moving away from the pain, I want you to actually move towards the pain and kind of side bend towards the side that hurts, rotate towards the side that hurts, and then also use a pillow to kind of prop your arm up like this, or anything that you can elevate your arm on to help slacken the muscle there, and that goes a long way towards relieving the pain. Okay guys, so this is my favorite exercise for the neck. I think of it as kind of a Control-Alt-Delete for your neck pain. So you can do this when you're having an acute episode of neck pain, or you can also do it as just a general strengthening exercise. And the neck exercise I'm talking about is doing cervical retraction. So it looks a little bit like this. You're going to be keeping your face as flat as possible. I don't want to see your chin going up and down, and you're just moving your head straight back, just like this. Back and forth. You can do 20 or 30 at a time. You'll feel a little bit of strengthening kind of anteriorly in the front of the neck and a little bit of stretch in the back of the neck. Make sure you're not moving your whole body, and just make sure that you're using just your head. So that's my favorite neck exercise. I hope you guys got a lot out of this series on the neck, and I will talk to you guys later. Bye.